Minister of Transportation. Order M33.
M33, third reading of Bill 33, an act to reduce the abuse of fentanyl patches and other controlled substance patches. Mr. Fedeli.
To recognize the member for Nipissing to move third reading of the bill. Member for Nipissing.
Thank you, Speaker. I move third reading of Bill 33, an act to reduce the abuse of fentanyl patches and other controlled substance patches.
Ellie has moved third reading of Bill 33, an act to reduce the abuse of fentanyl patches and other controlled substance patches. I recognize the member for Nipissing.
Thank you, Speaker. Again, I'd like to say welcome to the guests who have come from North Bay and from other communities throughout Ontario for being here today. Speaker, I am so pleased to speak to third and final reading of Bill 33, an act to reduce the abuse of fentanyl patches and other controlled substance patches. Speaker, I'd like to begin by reiterating something that I've said since the first day arriving here at Queen's Park. It is my firm belief that any time we can do something in this House that can literally save lives, we should be doing that. And this happened, Speaker, in our first couple of years here when we debated the Hawkins-Gignac Act on carbon monoxide detectors, which is now law and saving lives. And Speaker, Bill 33, the Safeguarding Our Communities Act, will do likewise. Since the last time we debated this in this legislature, there is further evidence to support that statement. From 2007 to the advent of the Patch for Patch program, which was pioneered in my hometown, fentanyl was a major factor in at least 2 deaths a year in my hometown of North Bay. Since the partners in our community implemented Patch for Patch and decided enough was enough, we've gone over a year without a confirmed fentanyl-related death in North Bay. Speaker, this program is working, and it will save lives across the province, as it is done in my city of North Bay. But, Speaker, I have to say, this is not my bill. This comes from the hard-working folks in my hometown. I am simply moving forward legislation province-wide of a solution that was developed by these good people in North Bay. And as I have mentioned earlier, we are joined here today by some of the folks who pioneered the Patch for Patch program that has so much success in curbing the trend of abuse. I would like to mention a few, Speaker. A lifelong friend of mine, Pat Cleash, of the North Bay Anti-Drug Strategy, is here today. North Bay Police Detective Constables Brad Rayum and Tom Robertson are here today. And I say welcome again. Welcome to you, and thank you. And all the others who are here and who have contributed, we appreciate that. I want to take a moment and thank a couple of the other key people who have made this possible. My executive assistant, Clint Thomas, who toiled so diligently for the last 16 months to see that this gets here today. From the administrative and the technical side, I say thank you to Clint for doing that. Carleen Varian of Indivior, thank you for the background and the service that you have performed to our province. And I want to say thank you to Bradley Warden. He's the legislative counsel who actually drafted this bill. These things don't just happen by accident. These are the men and women, many times behind the scenes, who make this. So again, Speaker, I say to you, this is not my bill. I'm just the vessel bringing this today. That's the way I feel about this. So let's take a moment and let's talk about fentanyl. Because for some, this may be the first time you hear it. For others, you may be very close to the tragedy that it brings to families. It's an opioid narcotic. It's a prescription drug that's generally used for cancer patients in severe pain. Fentanyl is 50 to 100 times more potent than heroin, oxycodone, or morphine. Canada ranks second in per capita opioid use. Ontario ranks first in Canada. Now, for people 25 to 34, 1 out of every 8 deaths were related to opioid use. Now, that's a 2010 statistic, and we know it has been skyrocketing since then. But this is an interesting fact. Third leading cause of accidental deaths. Fentanyl is the third leading cause of accidental deaths. Speaker, that's more than double the number of accidental deaths caused in motor vehicle accidents. That's how prevalent this is. And the abuse of fentanyl is a growing and dangerous trend in Ontario, across Canada, and across North America. Now, here's how we got to where we are today. In North Bay, an area between 2007 and 2013, there were 14 related fentanyl deaths in my hometown. As a result of the high price of fentanyl, crimes, break-and-enters, thefts, prescription forgeries, and prostitution is on the rise. This issue peaked in 2009, so the members that I mentioned earlier of the North Bay Police Service, along with our coroner, along with our medical officer of health, issued a public advisory about the risks of fentanyl misuse. So this is a story that I took from BC Global News. In 2013, North Bay Police Service conducted an undercover operation targeting traffic of the controlled prescription drugs such as fentanyl. In the project, numerous arrests were made and many charges were laid as well. Now, Speaker, the most common abused form of fentanyl in North Bay is what's called the transdermal fentanyl patch. The cost of a 100 microgram fentanyl patch in North Bay today, or North Bay then, runs between $400 and $500 on the street. As a result of the cost, fentanyl patches are most often purchased in pieces. A person may purchase a quarter of a fentanyl patch for $100 back then. The medication on a fentanyl patch is not evenly distributed, and that 1/4 piece a person purchased and is going to consume could contain a significant amount, in fact, maybe all of the fentanyl on that patch without the person knowing it. And if a person has not built up a tolerance to opiates, it is most likely that the fentanyl will have a lethal effect. I listened to Tom Roberts on, from the North Bay Police Service, tells a story from 2013 where he and his partner, Brad Rayum, were out on patrol and were parked on the side of the road, and one of the local drug abusers in our community walked up to their vehicle, knocked on the window and said, "You guys have got to do something about this fentanyl. It's killing all my friends." Now, they approached Pat Cleash, who I introduced a couple times already, and others at the Drug Strategy Committee in North Bay, and with them approached the doctors and the pharmacists, some of who are here today, and explained what was happening in North Bay. When they told them about the patch-for-patch idea, which we'll get to, they basically said this is a no-brainer. In the months following second reading of this Bill 33, awareness of the problem seemed to mushroom across the country. You could literally not open a newspaper without reading a story on fentanyl. Maclean's magazine did a cover story on fentanyl and talked about this Bill 33. In August, a large theft of fentanyl patches from a vehicle in Toronto prompted a public warning from the Toronto police. Inspector Howie Page said at the time regarding passage of this legislation, that would be a great bonus in helping police, helping the safety of the community. So we're hoping that this bill gets final assent. In North Bay alone, as I've said, at least 15 deaths have been linked to fentanyl in recent years. One death is too many. 15 in one town of 54,000 people is a number that this legislature cannot, with any measure of conscience, ignore. Fentanyl is a powerful pain medication sold in small patches via prescription. Like any opioid, it is prone to abuse. The patches are cut up and sold illicitly to addicts who have found ways to smoke, ingest, or inject it. When this program began, a full patch was going, as I mentioned, for $400 on the street. Today, it's up to $600 or more. We're seeing an impact on our streets, and it's impacting our police services and our resources. Not only are there serious health considerations, sale of these patches are empowering the criminal elements in communities across the province, in fact across our country, straining our police resources. And our local partners now tell us counterfeit patches are becoming a concern, and our doctors, pharmacists and police are continuing to work on ways to address that issue. The Ontario College of Pharmacists notes in the winter 2015 edition of their publication Pharmacy Connection that the Ontario Association of Chiefs of Police is leading the Patch for Patch initiative. It also notes in the College of Ontario Pharmacists, College of Physicians and Surgeons of Ontario, both support initiatives that curb opioid use, including participation on the Patch for Patch program. Dr. Kieran Moore writes, quote, "As president of the Kingston Academy of Medicine, I am supportive of this bill. The Patch for Patch initiative is an important step in reducing deaths from accidental fentanyl overdoses, which have more than doubled in Ontario since 2008. Speaker, I can go on and on about these letters of support, but let's just talk for a little bit then. What is this Bill 33 that was developed in North Bay? What is Patch for Patch policy? So Bill 33 would require a person prescribing fentanyl patches to record on the prescription the name and location of the pharmacy that will fill the prescription and to notify the pharmacy about the prescription. It also sets out various rules that apply to persons who dispense fentanyl patches, including a requirement that a new fentanyl patch may only be dispensed if the dispenser collects a used fentanyl patch from the patient or his or hers authorized representative, ergo the name Patch for Patch. Bring your old patch back, your used patch back, you get new patches. It would also authorize the Lieutenant Governor and Council to make regulations. Basically, here's how the Patch for Patch has been working in many cities and why it needs to be legislated across the province. This policy was, as I mentioned, developed in partnership with local doctors, pharmacists, and it stipulates that in order for patients to get a new fentanyl patch, they have to return the old one intact. It's pretty simple. Pat Cleash and others can tell you it has had a positive effect in our community. Now, at last count, 45 Ontario communities had either implemented or are looking at implementing a Patch for Patch solution. In Guelph, the Wellington Guelph's drug strategy produced an informational video, super video, on the problem of fentanyl abuse last fall as part of their program launch. Other communities to get on board include Windsor, Peterborough, Sault Ste. Marie, St. Thomas, Sudbury, Timmins, Muskoka. Speaker, if you go to the new website, patch4patch.com, and that's patch, the number 4, patch.com, not only can you see all of these videos, including the great video produced in North Bay, a series of videos produced in North Bay, you will get a full understanding of the magnitude of this issue across our communities, across Ontario, and indeed right across the country, including the Maclean's magazine. Again, Speaker, it's that critical that our national magazine did a front page story on it. So right now, Patch for Patch is being done on a voluntary basis, community by community. If you'll pardon the pun, it's done in a patchwork solution. The problem is this: so long as a person has a means of transportation to get to a community without a Patch for Patch policy, they can still continue this chain of abuse. That's why it's important to take this locally produced solution and have a province-wide solution, and why we've brought this bill forward on their behalf. There are several other reasons to do this. It's to generate public education and awareness regarding fentanyl abuse and misuse, and to guarantee responsible provision of this potentially deadly drug. It's to address proper disposal of fentanyl patches to avoid harm to others. Speaker, there are drug dealers who sell used fentanyl patches because there are still drugs inside that patch. That's why we want them returned, to address an identified increase in associated crime in communities. This increases have been seen in the number of overdoses and the mortality rates. And it's not just fatal, it's also non-fatal sicknesses that come from this. Speaker, this will help the significant amount of medical resources these cases use. The benefits of doing this are plentiful, Speaker. Partnerships with law enforcement, physicians, and pharmacists to ensure proper return and disposal of fentanyl patches. We see an anticipated reduction in accidental and non-accidental overdoses from fentanyl, and again, a comprehensive evaluation is currently underway in North Bay. This will limit the trafficking of fentanyl because you're limiting the supply. Elimination, this long-term goal will be to eliminate the return of counterfeit fentanyl patches and other issues around fentanyl use. Reduction of the amount of fentanyl on our streets will assist local police as investigations require significant time and substantial police resources to build cases against those with a legitimate prescription. This will assist local efforts to develop public education and awareness programs with various community partners. The benefits seen from sharing best practices among numerous areas of the province. Speaker, this bill provides a flexible response for both the government and regulatory oversight bodies to determine if professional conduct standards are being adhered to and determine what, if any, action is required if they aren't. It gives the minister the power to make regulations to deal with a variety of issues that may arise. Speaking of the minister, I would like to say thank you, Speaker, to Minister Eric Hoskins for his recognition of the serious problem of fentanyl abuse. I have spoken with him about this, and I really do appreciate his attention. I appreciated the professional, courteous way that the minister's staff and the ministry worked with us through the committee stage on this legislation, which was crafted to give the flexibility to make regulations as seen fit by the minister in consultation with all of the various stakeholders. Speaker, we may not always see eye to eye, but we've found common ground to work together here, and I'm so grateful that we were able to do that. Speaker, before I close, I want to read you the same message that I read in the introduction of this bill more than a year ago. This is a letter that I received from Sherry Albert of New Liskeard. Sadly, she couldn't be here today. But she contacted me after I introduced Bill 33 last fall, and she wrote the following. Dear Sir, I am writing to express my gratitude for your undertaking of this initiative. In 2011, I lost my 19-year-old son to this tragic abuse of medication. He was a gentle young man with many plans who was at the wrong place at the wrong time, and, as many others, did not know the danger of prescription medicine. The police determined that the patch was sold to his friend for $100. Since May 2011, I have heard of at least 4 more senseless fentanyl-related deaths in our very small community. I, too, am afraid for our youth. I would like to extend my offer to support this program by sharing my story with whomever cares enough to listen. My life has been forever changed and my heart eternally broken by the loss caused by this serious problem in our area. Very touching letter from Sherry. Speaker, I believe the approach advocated in Bill 33, which has already produced positive results in North Bay, is a model that will curb the dangerous and growing trend of fentanyl abuse across Ontario. This bill is about saving lives and helping the most vulnerable people in Ontario. Remember the words of Sherry Albert and try to put yourself in her shoes. Speaker, I would encourage all members of all parties in the House today to support this locally generated Bill 33 so we can start combating fentanyl abuse and its terrible consequences, and so Ontario can be a positive model for others to follow. Thank you very much.
Thank you very much. Further debate?